Hello, I'm Jake Boudrot, Civic journalist at Tello Community Television. This week on The Record, we speak with an NDP candidate for the riding of Inverness. We also sat down with an NDP MLA from Breton. But first, Zach Churcill, Liberal leader, answered a few questions. So with me today is Zach Churcill, leader of the official opposition, to discuss a number of issues of importance to our viewers. Welcome back to Tell Little, Zach.
Thanks, Jake. Thanks for having me back. Appreciate being here.
So recently it's come to light that the current government has announced additional appropriations of $1.3 billion outside of the legislative process, and that a projected deficit has now become a surplus. What specifically is your party's concern with this kind of spending?
Well, we've seen tax revenue shoot up in Nova Scotia, and the government clearly has the ability to reduce our taxation right now on people. People are struggling with the cost of living, no matter whether I'm talking to a fixed income senior, a working class family, or a young person coming up. Everybody is worried about whether they can continue to build a future and pay their bills here. The fact is that Tim Houston has had $7 billion more in sales tax revenue over his 3 years in government. It's an absolutely astounding number. And we're suggesting that we can cut the HST by 2 points from 15% to 13%. We don't have to be the highest taxed province in the country anymore. And the evidence shows that there's enough money now coming into the provincial government that the province can actually afford to give some of that money back to Nova Scotians so they can have it back in their pockets. And if we cut the HST, which again would be $500,000 from the additional $7 billion that has come in over 3, that could save the average family close to $1,500 a year.
Now, your party claims the provincial government spent $500,000 on the Nova Scotia Loyal ad campaign in the 2021 campaign, with the Progressive Conservatives touting the program as a key economic plank of their platform. But 3 years later, your party charges that the program has amounted to nothing more than an overpriced advertising campaign. Freedom of information requests obtained by the Nova Scotia Liberal Caucus revealed the Houston government has spent $543,000 in advertising on the Nova Scotia Loyal program since 2021. Your party states that the Nourishing Communities Food Coupon Program is an existing initiative that helps low-income Nova Scotians access locally grown food, and increasing funding for this program would allow more Nova Scotians to access fresh, local food at a time when food insecurity continues to climb. Should the Nova Scotia Loyal program be scrapped entirely?
Well, it's even worse than you said. I mean, the Nova Scotia Loyal program is another example of Tim Houston giving taxpayers money to his personal supporters and a big corporation in Sobeys. And the return that taxpayers get from that is only during 12 weeks of the year, they get an additional 50 cents worth of scene points if they can find something local to buy in Sobeys. So $6 million for this program, and 1 week a month, 12 weeks of the year, Nova Scotians, will get pennies in scene points. This is clearly a program that is going to do nothing to support our local producers, our farmers, our food growers. It is not going to help the consumers who are having a very hard time affording food right now, let alone everything else. And we certainly think that $6 million would have been much better used to support either the independent grocers and farm markets that actually sell local produce, and to help make food there more affordable, or at least allow people to be aware of where they can buy local food. Or it should have gone to the Nourishing Food Program that gives people vouchers to go purchase food at farmers markets. Food banks are also overstretched right now. Food insecurity has been shooting through the roof. There's more people hungry now in Nova Scotia than there has been in my lifetime. And food banks could sure use some more funding to purchase locally produced healthy food that they can give to their clients as well. So again, this is, I think, an example of corporate welfare, of people who are close to Tim getting taxpayers' money, uh, and us not really doing anything to help the local food economy, farmers, or people who are having a very hard time paying for food.
Yes, and according to your party, the 2024 Food Banks Canada report shows that 56% of Nova Scotians feel worse off this year than they did last year. Um, is a reduction in HST by 2%, as advocated by your party, going to make a real difference in the lives of Nova Scotians?
I think so. I mean, close to $1,500 a year for a two-income household, I think is a significant amount of money. And again, this is a savings on nearly every single thing that people have to pay for, from their, telephone bills, clothes for their kids, package food, school supplies, all these sorts of things. People are paying the highest sales tax in the country for. And we don't have to do that anymore. So we really do think, saving the average family, close to $1,500 a year is a good thing to do. And it's also about being fair to people here in Nova Scotia. We don't have to be the highest taxed province in the country anymore, and we can certainly have fair sales taxes to help make life more affordable for people on the everyday goods and services that they have to pay for each and every day.
No,
This would go ahead.
no, you continue, please.
I was going to say for you know for what this would save families, this is a much better deal than getting pennies in scene points.
Now, on the issue of affordability, your party's pointed out that Nova Scotia has seen some of the fastest increasing rent prices and inflation in the country. Power rates have climbed 15%, and 30% of households are now food insecure. And your party stated that affordability is a big problem. While the province has a role to play, how do you answer the charges that it's more on the federal level? The federal government has more of a role to play. I assume you believe that the province has a role to play as well.
Well, all governments have a role to play, but when it comes to the tools that are in place to help people deal with cost of living, those are primarily in the provincial toolkit. So housing is a provincial responsibility, energy is a provincial responsibility, and many of our taxes are provincial responsibility. So we have seen under Tim Houston housing costs skyrocket in Nova Scotia. And a part of the reason for that is because he is trying to double the population of this province successfully at a time when we're out of housing. So having more supply of people when the supply of houses is not keeping up with that is impacting availability and price. It's a supply and demand issue in part. And we also are paying some of the highest taxes again in the country. And he has gotten $7 billion more in revenue alone from sales tax increases in the last 3 years. So when it comes to things that the province can do, and I'm a provincial politician, my focus is on what we can do provincially on the housing front, on the tax front, and on the energy front. We've not seen any major moves from this government. In fact, we've seen the costs for all these things go higher and higher for Nova Scotians, and the province is the one that does have control over these things.
Now, no interview would be complete without a discussion of healthcare. Since the current government was elected in August 2021, your party claims that Nova Scotians are worse off than they were under the former Liberal government, pointing to the nearly 100,000 Nova Scotians without a family doctor. Wait times to see a specialist are double the national average. Ambulance offload times have tripled in parts of the province, and emergency rooms are either closed or bursting at the seams, according to what your party is claiming. Was this current government wrong to spend billions in healthcare, or was it that the investments were in the wrong areas and not targeted in the areas that needed it most? And what are those areas that they should be targeting?
I think the things that really matter to people in healthcare is if they have attachment to a family doctor or a primary care provider like a nurse practitioner whether they can get emergency department services in a timely fashion when they need it most, and whether they can rely on ambulances getting to them in a reasonable period of time. And we have standards for that in Nova Scotia. All three of those things have certainly gotten dramatically worse under Tim Houston, because the investments have not been in these areas, and the focus has not been on ensuring people are attached to primary care providers like family doctors or nurse practitioners or the emergency departments or the ambulatory system. So we actually now have 160,000 people without a family doctor. When Tim Houston became premier, that number was lower than 70,000. Wait times have nearly tripled for ambulances in many parts of the province. Wait times for specialists are going up, and a lot of that is because people don't have access to family doctors or primary care providers. So not focusing attention on that, giving up on the family doctor model, I think has been a major mistake that this government has made, because if people don't have access to family doctors or a primary care provider like a nurse practitioner, they're not looking after their health as well. They tend to get sicker, and they end up showing up in our emergency departments when that could have potentially been prevented, or perhaps they're showing up in emergency departments when they don't need to for things that aren't emergencies. So I think that has been a major misstep by this government, is not focusing on that particular issue. And if you look at a lot of the money that's been spent, it's on things that I think have, captured headlines and are all about trying to tell a story about healthcare and market what the government's doing instead of actually improving outcomes for people. And I think there's very clear examples of that. $500 million for a bonus for nurses that was supposed to bring back 2,000 nurses into the healthcare system. Just over 100 came back, so that clearly didn't work. That was $500 million. Purchasing a half-built hotel here in Halifax that's now going to cost hundreds of millions of dollars to the taxpayers, when healthcare professionals said that this wasn't going to be a suitable facility to look after patients. And I think at the end of the day, firing the healthcare professionals that were running our healthcare system and putting in, a conservative lawyer to run the healthcare system has ensured that there's more of a political lens on what's happening in healthcare instead of, a policy lens. And I don't think you improve outcomes for patients or the public when that's how you approach healthcare.
Now, talking about physicians, a recent exit survey of physicians obtained by the Nova Scotia Liberal Caucus through a Freedom of Information request shows that 60% of doctors who left the province in the past 3 years did so for other employment opportunities. Nova Scotia Health Exit Survey was completed between May 2021 and December 2023 and received 73 responses. Nearly half of the doctors say they were dissatisfied with their position and cited their work environment as a primary reason for their departure. More than 36% of physicians who completed the exit survey said the organization could have prevented them from leaving. Is it true that doctors who have immigrated to Nova Scotia have been set up to fail?
I mean, that's indicated certainly in those survey findings when you've got doctors leaving and saying that the management team could have done a better job in keeping them there, or that their working conditions weren't satisfactory. I mean, that's an indication that things aren't what they should be within the health authority. And again, the first thing that the premier did when he came into government was politicize the operations of our healthcare system. Previously, we had a doctor and professional healthcare administrators that managed the healthcare system. We now have a conservative lawyer with no healthcare experience that is helping manage the healthcare system out of the premier's office. So if you're looking at the healthcare system primarily through a political lens, you're going to be more concerned about what people are saying about the healthcare system than you are about how well that system's doing. And I think there's evidence of that being the priority, because big money is being spent in areas that aren't having an impact on patient care, and you actually have doctors that are working the system that are indicating that they're frustrated with that.
Now on to the Coastal Protection Act. Your party claimed that the government is flip-flopping on the Coastal Protection Act because the Progressive Conservatives supported the legislation back in 2019, but decided against making it the law after taking power, noting that this could have serious implications for taxpayers who will be on the hook for homes that are destroyed by coastal erosion, serious weather events hit the province with more frequency and severity. Is your party correct in asserting that most Nova Scotians want legislation? Because I know when we spoke with the Richmond MLA recently, he was of the belief that not a lot of people want this. Do you believe that most Nova Scotians do want this?
Well, the vast majority of people that were surveyed on this wanted it. So in terms of what data we have, that indicates that the majority of people want this. It's also really important for our province to protect our coastlines and to protect people from developing in risky areas along the coastline. Climate change is getting worse. We've seen that in the last few years. We are not protected from extreme hurricanes anymore like we used to be. And if our coastlines aren't protected, people's lives and property are going to be in danger. And that's a risk to them, of course, but it also means the liability for that tends to come back on to the government and the taxpayers, because oftentimes, insurance aren't going to cover a lot of, climate related impacts on property. So this is about protecting people's life, protecting our coastline, and making sure we're doing a better job preparing ourselves for the impacts of climate change, not even in the long term, but in the short and medium term as well. And again, I think this is another example of Tim Houston breaking his word. He promised Nova Scotians he would do this. And I think the reason that he's not moving forward with this is because he's got rich developer friends that don't want him to do this, because it could impact their development plan. So I think they have made this decision wrongly and for the wrong reasons.
It looks like there's going to be an election next year. And I guess my question for you is, as a Liberal leader, are you confident your party is prepared? Do you have the candidates that you need in place and the platform items I assume you guys are deciding on? But are you confident you guys are ready for the time when the writ is dropped?
Well, I'll remind folks that Tim Houston's first piece of legislation that he passed, his first law, was a fixed election date. And this was a promise he made to people in his election platform. So there is supposed to be a fixed election date next summer, the summer of 2025. So if an election happens earlier, and the premier again seems to be flip-flopping on this issue, like he has many other issues, that would mean that he would be breaking his own law and breaking his word to Nova Scotians on a fixed election date. Realizing that we don't know if we can trust his word on this, specifically because he seems to have changed his mind recently, we are getting prepared as quickly as we can. And a key part of that is obviously making sure we know the big issues that are affecting Nova Scotians and the ideas we're going to run on to help, and also finding good local, high quality candidates. And I think we've made really good progress on both of those fronts. We're getting really good people interested in running from one end of the province to the other, which is really courageous for people to do, particularly at a time when people are struggling and are frustrated with our system of government. And we will be prepared with a slate of commitments to Nova Scotians that we think can help improve their quality of life and make life better for them, more affordable, and ensure that they've got access to the government services they need when they need it.
Thanks for thinking of us and sitting down and answering these questions.
Certainly. Appreciate the opportunity.
With me today is Joanna Clark, who was nominated on August 1st as the NDP candidate in the riding of Inverness, which covers the town of Port Hawkesbury and all of Inverness. Welcome to Tello.
Thank you for having me.
So maybe we can start by you can tell us a little bit about yourself for those who might be unfamiliar with you.
Sure, yeah. My name's Joanna Clark. I live in Port Hood. I am a teacher and have been for the past 3 years. I graduated in 2020. Um, I didn't work in teaching my first year because of COVID, so I kind of found a different job for that time. During that year, I worked for the Canadian Federation of Students, which more or less advocates for better post-secondary education circumstances, whether that be through, lowering tuition, um, better healthcare for international students, ensuring um, administrative clarity, like understanding all of that kind of stuff. And that's kind of sort of where I got my start, I guess, or interest in different sort of policies and politics and things like that. Um, and now I'm on maternity leave, waiting to go back to school. I've been working a couple jobs in different restaurants. So yeah, I have a background that's a little bit diverse in all different kinds of fields, and very excited. And I think that that lends well to kind of running in this election and also in the last election as well.
Yeah, you mentioned that you ran last time and you decided to throw your hat in the ring again. So why did you decide to run on the provincial level and to be an MLA for Inverness?
Well, I think last time especially, I kind of was like, I'm probably gonna have to run more than once. But really to me, I just felt like we all kind of have this ability to be a representative of these conversations, but I think that it's hard when we have this idea of what a politician is. You think a business person, or especially men, um, higher ups, things like that. And so I personally felt like I wasn't really seeing anyone that represented me when I looked at people that were running. And so if I felt that way, I'm sure other people are feeling that way. And so I think that by putting my name forward, it kind of showed like we all kind of have a stake in this. Our province is changing. And we should all be able to feel like somebody is there representing our voices. So I'm just there. I feel like, I'm representing maybe a group of people that didn't see themselves represented before, or I hope so anyway.
Why did you decide to run for the NDP?
For the NDP in particular, I just feel like looking at their past platform, obviously we're building a platform now that's going to be very reflective of current issues um, to come in this next election. But last election, the policies and the platform that they were running on really did align with my own values, and I can see and I'm sure that that will be the case this time. I think that the party is really calling for affordability for everybody, ensuring affordable housing, ensuring shorter wait times for healthcare. And so those are all things that I feel very passionate about. And so I think that my values and their values align. So I think that that's why NDP is kind of where my interests lie for representing folks.
So as you see it, what are the main issues facing the voters of Inverness right now?
Right now, I think I think healthcare is obviously top of the line, I think, for everybody in our province. Housing is definitely a huge issue in our rural areas. I feel like a lot of young people have moved back or are trying to move back, but housing is just not where it needs to be. Um, and I think internet and cell phone coverage is also still a huge issue that we're hearing a lot of. Everybody has something to say um, about cell phone coverage and internet connectivity as well. So I think those are maybe some of the top three things.
So what are your plans to deal with these issues? Your ideas for addressing these? those issues you've identified?
I think first and foremost, a lot of the conversations still have to happen, and I think it's about getting creative at this point. And what that looks like, not entirely sure. I think hopefully we have time to kind of like build this. That's kind of why I think it's important that my nomination is early, so that I have time to talk with folks. My last one thing I learned from the last election is I did put my name in pretty late. So I didn't get to talk to a lot of people. And I think that that really is the most important thing, is talking to the people, the voices at the front lines, and making sure that you get the ideas from the people that are living with these issues all the time. And then also I think, yeah, it's about getting creative and trying to figure out ways that maybe we haven't considered already, and how to make, a different way work. Because we're kind of at a standstill with certain things. And so creativity, I think, is going to be the number one, thinking outside of the box, how to make things work.
So if you are elected, what are your main priorities for the riding? Meaning, like, what are the goals you want to start working on and seeing some results in your first term?
Um, that's a good question. I guess I haven't really thought that far ahead. I'm really just thinking about, you know, um, connecting with people and hearing what their concerns are. Like I said, those top three concerns I think are really important. And just to even add, so like affordable housing, like how do we get young people in housing? I think that that's really important. Because we want to have young people working in our communities and living in our communities. So I think housing is a huge issue. And healthcare and wait times is really important as well. And how to make, and that kind of ties in also, I think, in our riding as well. We do have an aging population, so making sure that seniors are also taken care of in that. But overall, I'm hoping to make the most of my time and campaigning to really talk with folks and see what they're bringing up as other issues that maybe I haven't been able to hear any stories from or understand that perspective. So yeah, I think it's about listening to people and then working on those three main things that I mentioned before.
Mm-hmm. Now, you mentioned that you're getting in the race earlier than you were, and the fixed election date of July 15th, 2025 is less than a year away, and there will be an election sometime in the next 12 months, it appears. And you mentioned that you plan on talking to people. Do you have any other plans now that you're able to get ahead of things and really have time to do some campaign?
Yeah, so I really, that's really important to me this time. Definitely is, maybe having a meet and greet events is kind of, I'm hoping to have that, or like a town hall type thing where people can come and kind of share their concerns. Because last time I did a little canvassing and talked to a few people, not a few people. I knocked on many doors, but I didn't have the time to really go out into the whole riding. Because it is, like you mentioned, it covers the town of Port Hawkesbury and all of Inverness County. So it's a really big riding. And so I'm really hoping to put a dent at least into each community, so that I can talk with people that are really all the way up to all the way down in the riding, because I did feel like I missed that last time, and that was just because I threw my name out so late into the election process. So I really didn't get to talk to as many people and hear what their concerns were the last election.
Well, that's great, Joanna. I really appreciate you taking time out of your day and taking time away from your busy schedule to answer my questions and speak with me today.
Yeah, thank you so much for having me. Hopefully, we'll have more events along the line, and I'll cross paths with many people from here until the July 15th election date.
With me today is Kendra Coombes, NDP MLA for Breton Centre-Whitney Pier. Welcome, Kendra.
Thank you for having me.
The NDP said it is concerned with the amount of spending by the provincial government that is taking place outside of the legislative process. The NDP asserts that although the Houston government announced additional appropriations of 1.3 billion, you're still not seeing the results that Nova Scotians need. Is the concern over a lack of public accountability, or is it that it's hard to predict whether this government will post a deficit or a surplus because of this spending, or is it both? What is the concern?
It's all of it. It's one, this government has continuously said they're going to run deficits and have actually got surpluses. And in that, they're continuously spending outside the budget, more so than any other government prior. They've gone outside the budgetary. And when you're dealing with public money, there needs to be some oversight. There needs to be accountability. There needs to be a transparency. And this government continues to not have oversight, not have accountability, not be transparent with how they're spending the money, because what we're not seeing where that money is going. We're not seeing if it has had any help on Nova Scotians. Now, we can tell you it hasn't. People are struggling to afford the basics. Forget luxuries. People are struggling to afford the basic necessities of life that they need. Healthcare is still a mess. The family practice registry is an all-time high. Last year, we saw 20%. We saw deaths, emergency room deaths, rise by 20% last year. And cost of living. There's no money attached to for new public housing. We are not seeing from these surpluses. We are not seeing from that the government has boasted. We're not seeing the amount of outside the budget spending. We're not seeing any of that helping Nova Scotians.
Mm-hmm.
So that is a big concern. We understand when there is a mass incident. We've had them multiple times. We understand when government needs to spend money because there has been a crisis. There has been we have had disasters. We know that money has to be spent. The problem is the government never comes back to the legislature for oversight. And also, we don't see all this money that's being spent outside the $1 billion outside the legislature, where that money is going and how it's actually helping Nova Scotians. And that's a problem when unfettered spending is not coming back to the legislature for even oversight or accountability.
Now, despite the unexpected surplus of $143.6 million, the Houston government also won't commit to increasing the public housing supply the NDP claims, making this the third year in a row where a province ended the fiscal year with a surplus, yet chose to put it away rather than using it to help Nova Scotians in the immediate term. Where in housing should this money go? And in addition to housing, where else should this money go? And should it be spent now?
Well, what I think it needs to be done is, yes, we are in a housing crisis. We have so many Nova Scotians living in housing that is inaffordable. We have so many Nova Scotians living on the streets and living rough. We have so many Nova Scotians who are couch surfing, living in conditions, housing conditions that they should not be living in. They're inappropriate, dangerous. Housing. And so, yes, we need the government to actually spend money in housing. We need to see money being spent that's going to help Nova Scotians. If that's helping Nova Scotians in affordability, at the grocery stores, helping them be able to afford the basics of life, then that's where we need to start putting that money.
Now, after the recent launch of the Nova Scotia Loyal Program, which is a $6 million program that will provide Scene Plus and Air Miles points to shoppers, buying local products, the Sobeys and the NSLC. Your party pointed out that shoppers won't be able to collect points at other businesses. According to the Houston government, Nova Scotia Loyal branding will be available to retailers who don't offer reward points. The NDP notes that in May, the Houston government awarded Sobeys a $950,000 sole source contract participating in the Nova Scotia Loyal program. Your party goes on to say that members of the Sobey family donated a collective $17,000 to Tim Houston's 2018 leadership campaign and donated $14,000 to the Progressive Conservative Party in 2020. The party has continued to make donations in recent years, your party notes. The NDP claims that it took the government 3 years and $6 million to launch this points program, but does not justify the time spent nor its price. Under the Freedom of Information Act, the NSNDP obtained a 2022 report testing different incentive options for the program, but offering extra reward points was not tested during the research phase, your party noted. The 2022 report found that offering a monetary incentive, such as a gift card, with the purchase of local products was the most effective way to influence customers. It also found that customers were more receptive to incentives offered in independent stores compared to Sobeys. During the testing phase, Sobeys was the only big box store that was studied, your party noted. Should the government have not proceeded with the program, and what would your party do instead to help the economy?
Well, I can't tell what the government's going to do with their, but the research is evident and they went pretty much against what the research was stating. The fact of the matter is that this program, this Nova Scotia Loyal program, which is really Sobeys Loyal and NSLC Loyal program, is not going to really help small businesses. It doesn't incentivize anyone to buy at local retailers. It doesn't help local businesses. That's the fact of the matter. The idea of this whole program, as we were waiting for it, we thought was going to be shop local and do incentivizing to shop local. But really all it's doing is one week out of a month, Sobeys and NSLC will give you rewards points. 1 day out of the month, or 1 week, I'm sorry, 1 week out of a month, I believe it's going to give you rewards points. And it's going to pay for signage, buy local signage. There's already buy local signage in every grocery store. There's already Nova Scotia wines, the Nova Scotia craft breweries, all that in the NSLCs with great big signage. So this is not really much promoting of local. It's not worth, the $6 million to create this program. It's not worth that, because we already have these types of we already have these programs available. The only difference is the points, the local 1 week out of the month, local points. The one aspect of this program that is a change that we've been advocating for is the procurement. That would have government, that would allow small businesses in Nova Scotia or producers in Nova Scotia to compete for small contracts, and having the government being incentivize the government to procure local is something that we have championed in the Nova Scotia NDP for quite a long time. So it's good to see that part. But for the rest of it, it does not help incentivize any real buying of local. It does not help incentivize any local businesses or retailers or producers.
Now, earlier you hit upon the healthcare file, I guess, if you want to call it. And now we're almost exactly 3 years into the mandate for the current government. And there's still, I think your party estimated 16% of Nova Scotians still without a doctor. And your party's charging that the Premier's promise to fix the healthcare system, those promises are falling short. Your party noted there was a net increase of 10 family physicians for the fiscal year 2023-2024. The inflow of family physicians declined by nearly 30%. There are only 121 family physicians per 100,000 Nova Scotians, and there were only 7 emergency department hires between April and November 2023. And this is according to numbers from the Department of Health and Wellness. Well, your party's calls for expanding collaborative care, increasing patient attachment to primary care, and ramping up efforts on physician recruitment and retention solve these problems? Aren't there other steps that should be taken, or are these the core problems that need to be addressed now?
One of the biggest problems we have in our healthcare system is the lack of human resources. We cannot retain people. We need to be able to retain them. That means we need to know what we can recruit all we want, but if we're not retaining what we're recruiting, we're falling short. And that's what we're doing. We're falling short on retention, on recruiting and retention. So we need to recruit and we need to retain those people. In order to do that, we need to pay them proper wages. And we need to give them the work-life balance needed, which means we need more people working in the system. So that, and the collaborative care, the NDP started collaborative care under the Dexter government. And it worked very, very well. The previous government didn't pay much attention or spend much money on that effort of collaborative care. And this government continues to fall short. The Houston government continues to have an app for that, rather than actually investing in our healthcare system and our human resources in our healthcare system. This government is continuing giving money to tech companies for apps. How can a doctor virtually diagnose you on an app? They really can't. But this government they're saying that your health record, your health care app, whatever it's called, that's going to help fix healthcare. No, it doesn't. What it does is it allows you to have access to your healthcare record, but it doesn't provide you with primary care attachment. It doesn't help you get into a walk-in clinic, which, by the way, there's no such thing as a walk-in clinic anymore. You need to know that you need a clinic a couple days in advance to get on the list. This is how bad our system is. Some people with their primary care doctors won't get in to see their primary care doctor for a month to 8 weeks. This is just ever increasing. Emergency rooms are closing all the time because of lack of human resources to staff them. Wait times at emergency rooms are continuously increasing. And this is where we're at. We are in dire straits with our healthcare system. Our healthcare system has not improved. It has gotten worse. And this government has decided that there's an app for everything rather than what is actually needed in healthcare. And that is attachment to primary care. That is to be able to see a doctor or a nurse practitioner or a physician assistant, and all those other specialists that are in our system. These are very much needed, and we're not seeing an increase in those. We're not seeing an increase in retention and recruitment, and we're not seeing changes in wait times.
Mm-hmm. Now you talked about this earlier. You just mentioned that your party's continuing to call for the Auditor General to review the Your Nova Scotia procurement deal with Think Research, noting the province spent $15 million with no clear return. The government announced an expansion of the app to allow patients to access their health records after a 3-month pilot project. But according to Freedom of Information requests obtained by the Nova Scotia NDP, only about 1% of the pilot project users completed a survey about their experience. Of those, less than 1/3 felt they didn't need to visit their primary care clinic due to having access to their records. Just 35% reported feeling better prepared for their appointments. Nova Scotia Health says the app is about 2,000 to 2,500 average unique users per day, and an average time of about 2 minutes spent interacting with the app. Your party noted. Does your party support using the app, or is this just a waste of money and something that should be spent on other healthcare priorities?
It's not whether you support or not. It's the fact that only what, 1% or so of people completed a survey. And the information that we gathered, that's not enough to provide us with any information on whether this is helpful or useful to anybody. Because if 200 people are using it, for instance, and one person does the survey, you're not getting a full scope of if this is helpful or not. Now, is it helpful for some people to have their full medical record at their fingertips? Yeah, some people might like to have all that information, especially right now, if they lose their doctor, they could be able to have it. The problem is we're not seeing the returns. We're not seeing improvements in our healthcare system based on these apps that the government keeps coming out with. We're not seeing the improvements that they say we should be seeing. We're not seeing them. That's the point of the fact. It's not about whether or not to use them. Healthcare probably needs every tool in the toolbox, but when we are not seeing returns, when you're not seeing healthcare improve, that's where the focus needs to be. How are we improving healthcare? Is healthcare improving? And the numbers say they're not. Nova Scotia government's own numbers are saying healthcare is not improving.
Mm-hmm. Now, on another topic, the NDP stated that the provincial government has been sitting on a consultant's report recommending the creation of a residential tenancies enforcement unit. Your party asserts there are no meaningful repercussions for those who violate the Residential Tenancies Act. Would this not create another layer of regulation and bureaucracy and red tape in a problem where housing is needed, or is this just something that you have to have in order to have some kind of functioning system?
The thing is, we don't have a proper tenancy safety net. Right now, if you ask any tenant about the Tenancy Board, the Tenancy Act, if you ask landlords about the Tenancy Board and the Tenancy Act, it's not working. And oftentimes what it falls down to is the police coming in and having to enforce tenancy issues under the Tenancy Act. We've seen that here. I've had to help people within the CBRM whose landlords came and took the doors off their apartments. And the person you call are the police. We don't have an enforcement of our Tenancy Act that is appropriate. We need a tenancy unit, enforcement unit that is going to be strictly on the Tenancy Act. This would actually help deal with the bogged down paperwork and the bogged down hearings at the Tenancy Board. The fact of the matter is, for a number of years now, tenants and landlords have been calling for an enforcement unit. It is the only way to ensure fairness within the system.
Mm-hmm. Now, you hit on affordability earlier, which is a problem that's plaguing a lot of people these days. And during a trip to Cape Breton recently, your leader, Claudia Chender, noted that the island is among the highest child poverty rates in the province, with many families struggling to afford basics like housing, groceries, and power. What are the solutions to this in the short term and the long term?
Well, one, we need to create as much housing as we possibly can through nonprofit housing, co-op housing, public housing, government money in public housing. We need the Tenancy Enforcement Act needs to be enforced. The Tenancy Act, I should say, needs to be enforced. We need to see, we need to be able to do, and this is something we talked about within our party during the budget session, and that is reduce the cost, taking the tax off of particular grocery items in the store So for instance, granola bars. Granola that is not does not have chocolate in them are not taxed. But if it has chocolate in it, it's taxed. If you get a watermelon whole, it's not taxed. But if you get one that's cut up, it already has a surge charge on it for convenience. And then you go to the cash register and it's taxed. We can do things like that to eliminate tax. With regards to Nova Scotia Power, we need to start reducing bills by providing more help for Nova Scotians to do more energy efficiencies in their home that will help reduce the power bills. And the other thing is we need to rein in Nova Scotia Power by putting in performance regulations.
Well, that's all for me, Kendra. I really appreciate you making time out of your day to answer my questions.
Thank you. I hope I hope that helped and I was coherent.
Thank you for watching. Please tune in again to find out what we will be talking about on The Record.